Hello and very good evening, all of you. I'm Dr. Pooja, DBMCI faculty of Physiology subject, and as you know that the Bhatia DBMCI is coming up with the PYQ, that is the previous year questions. Now over here we are going to discuss two paper each, that is NEET PG question paper and INI-CET question paper. Since you know that the latest just now which is left, that is the INI-CET November 2021 and the NEET PG 2021. We are not going to discuss that because that is already discussed just few months back, right? So that's why we are not going to deal with that. But yes, definitely what we are going to do is that we are going to discuss the papers which were there before that, right? So I hope you guys are online. Please let me know some thumbs up, some nod, some smile, right? Good evening, Achan Khan. Achan Khan. Okay. I hope the audio video is clear and let's start with the question. Now, this is the time given to me, that is 8 to 9 p.m. But definitely I cannot cover all the questions. Otherwise, it will be very, very rushed. But definitely, I'm assuming that you read through the physiology and that's how we are going to deal with this. I'm going to be a bit faster in this, right? Wherever you want me to discuss again, then definitely we are going to go over that. Right, I'm looking at your comments over here on the YouTube. Right, so let's start. Let's begin our class with the full of energy. Right, next like 1.5 hours. Right, so first of all we are going to discuss the question that came in NEET PG 2021. Right, the first question of physiology which appeared says that identify the sleep wave marked in the EEG during the sleep wake cycle. Awesome evening, all of you. I was not expecting this much of the response, but thank you for all of this love that you're giving me. Now, can you give me the answer of this question? Be quick. Can you give me the answer of this question? Now look at this wave. What do you think? Which wave this is? Now we know there are 4 types of wave: beta wave, alpha wave, theta wave and delta wave. There are 4 waves. Now we divide them into depending on their frequencies. As I told you in the classes, how to remember if the frequency is going, see over here the timing is given more, this is 1 second. What do you think? The frequency is very, very high. Right, I got the right answer from Masur. Right, Divya, think again. Hemal, think again. Nasira, superb. Right, and also Balaji, superb. Yes, so what we are discussing over here, see, we will start from 0. Now what I'm writing, hertz, that means oscillation per second, the wave oscillation per second. If it is 0 to 3, we are going to call it as delta wave, right? If it is 4 to 7, then we are going to call it that theta wave. If it is 8 to 13 hertz, we are going to call it as alpha wave, which usually find out in the meditation. Why I'm specially telling this? Because remember, like in 2018, 17, 15, all of in these NEETs they concentrated on the alpha wave, and now in 2020 they ask about the beta wave. The answer over here is beta wave. Why? Because if the frequency is fluctuating between 14 to 30 hertz, that means 14 to 30 you can say oscillation per second. You can see that there are many oscillations. You can see definitely they are more than 30. Right, so definitely the answer over here is beta wave. Now these are asking about the sleep. Now what do we say? That if we divide the sleep into 2 phases, NREM and REM, as we know that NREM sleep is again divided, it used to divide into 4 phases, 1, 2, 3 and 4. Now these 3 and 4 combinedly in this latest edition of Ganong, they are calling it as only 3. So in the options, you will not be able to see option NREM 4, right? If the examiner is going through the latest Ganong edition. Now these two, the NREM 1 and 2, it is called as light sleep. Light sleep. That means you just call a name, the person will wake up. right? And these two are called as deep sleep. ढोल नगाड़े बजाने पे भी अगर कोई नहीं उठ रहा है, if you even call his name, you just shake him, he is still not able to wake up, then that is known as deep sleep. How to remember? D for deep sleep. And in these two phases, mostly we are going to see delta phase, delta waves. In the light sleep, it starts with the alpha wave and it turns out to be later on it goes into the theta wave also. Now, where from this beta wave is going to come? Remember, in the REM sleep, rapid eye movement sleep, in that we see mostly the alpha wave, but these waves can be blocked by the beta wave in between, and that is known as alpha block phenomena. It is seen as if the beta waves are blocking the alpha waves in between, and that's why it is known as alpha block phenomena. Now, if you know more will be the frequency, more is your brain activity. Usually in the sleep, the brain activity should be low, but over here what we are seeing in the REM sleep is that the frequency is increased rather than decreasing, and that means your brain is more active during such a sleep, and that's why this is known as, yes please, this is known as paradoxical sleep, right? Paradoxical sleep. In the sleep, the brain activity should be low, and the brain activity is directly proportional to the frequency of the waves, right? But over here, what we are seeing, the person is in the sleep, but the brain activity is what we are recording is getting more and more. That means the brain is more and more active. So that's why this phenomena is known as the paradoxical phenomena, right? Or it is known as the alpha block, right? So in the REM sleep, we are going to see, first of all, you have to identify the wave, that is the beta wave, right? Usually they will give you in the descending or ascending order. So it is very, very easy. You can remember as bat dance. The bat is dancing when we are sleeping, right? So that's how we used to remember, we say the trick to the students, right? So this is the REM sleep, paradoxical sleep. Let's move on to the next question. Second question, very, very easy question. Yes, guys, please, quick answers, quick answers. Preterm baby with RDS, nothing to think, right? This is the easiest question every time from the recipe. This type of questions are asked, right? What is the answer? Yes, please. Quick, quick, quick. Yes, Mysore again gave the right answer afterwards. Lakshmi, I got the answer from you. Superb, Lakshmi. Yes, Rahul, Krishna, Hemal, Nasira, Dharma, Abhi, Balaji, Russell. Awesome, guys. Awesome. Right? These type of simple questions should not be mistaken. We all know the type 2 alveolar cells, they are going to produce something known as surfactant, and the surfactant get mature on and around 34 weeks of intrauterine life. And if the preterm baby or premature birth occurs, this cannot get mature properly. The surfactants will not be mature and their secretion will not be maximum, and that's why it will not be able to oppose that inward force which is known as surfactant, right? Surface tension, which is opposed by the surfactant, right? So surfactant opposing the inward force, that is known as surface tension. So that's why if that surface tension is not reduced, the baby's alveoli will not able to you can say inflate properly, and that's why the baby is going to have some difficulty during the respiration, and that's why it is known as respiratory distress syndrome. Suppose this time I do not give this answer as type 2 alveolar cells, there are some other options, right, which can come. Remember, if these cells are not there, then there are some proteins which help these surfactant to grow, to secrete, to get mature, and these are nothing but surfactant protein A, surfactant protein B, surfactant protein C and D. These all help in the maturation of the surfactant, right, and they are secreted by the Clara cells. There are two theories, right? One says that they secrete the surfactant proteins which help in the maturation as well as they help in the reducing surface tension. Some say, the another theory says that these Clara cells, they can act as a stem cell for the type 2 pneumocytes also, right? Any theory comes, the theory they are not going to ask, it is still in research. But remember, if the type 2 alveolar cell is not in the option and the Clara cell is in the option, then you are going to mark in the Clara cells. Agree? Right. Okay. So if both are the options, type 2 pneumocyte is the best answer. Let's move on quickly to the third question. Now over here, motorbike accident was there and we need to remove poor guy's entire ileum and partial jejunum. If entire ileum is gone, it is resected, which of the following would the patient suffer from? Answer, very easy question. Hanji, चलो बताओ बच्चों, बहुत जल्दी जल्दी बताओ. I'm waiting for the answer. Yes, I got the answer. So I want to show you one diagram for that purpose. Right over here, I was downloaded this diagram also. If you want to like take a screenshot of this, or you can get this on the net also. That's how we discussed. This is from the net. It is not proper. So that's why some changes are there. The frequencies that I told you, these were from genomes. Right? Fine. Now look at this diagram. Now what is going to happen? The B12 is very delicate kind of vitamin, right? It needs protection. So what is going to happen? That two things, they are going to protect them from destruction, not from digestion. Remember, there are two different terms. First thing, heptocorin, and second thing is intrinsic factor. They are going to protect that vitamin B12, right? And this will allow it to go towards this area which is known as terminal ileum, right? And from where it is going to get reabsorbed or absorbed from the GIT into the bloodstream. But what we are saying over here, that we remove partial jejunum till the complete ileum. So this area is not there. So no matter how much B12 the person is going to eat, it is not able to get reabsorbed in that area, and that's why the person is going to have what thing? The beta 12 deficiency, vitamin B12 deficiency. Thank you, Malai. I want you guys to be energetic also, right? Transcobalamin. Superb, superb, superb. Chalo, let's move on to the next question. Very easy question. Easy question should not be mistaken no matter what. Okay. Now, next easy question. Reflex in which there is inhibition of gastric emptying, where there is acid and hypotonic solution in the duodenum. Now, even if you do not know this, then also you should be able to answer this question properly. Just give your 100% attention, right? The reflex is starting from the duodenum and it is inhibiting the stomach. So what do you think? What should be the answer? Yes, Hemal, right. Abhi, superb. Soumya, yes. Krishna, Lakshmi, Balaji, Rahul. Awesome, guys. Mulai, Dr. Chandan Mishra, Yash. Awesome, awesome. So yes, definitely entero means intestine, right? And gastric means stomach. So whenever the fluid or the acid, basically it is going to come into the intestine, what is going to happen is that, I hope I have that diagram, then once this is going to come into the, sorry guys, I don't have the picture right now. So whenever the fluid is going to come, hypotonic fluid, or you can say also the acid, whenever it is going to come from the stomach into the duodenum, now the duodenum do not want more acid to come because it is not having that gastric acid barrier, right? So what it is going to do now, it got to know that yes, now the function of the stomach is over. Now I need to absorb the food or nutrients, right? So it goes and inhibit not only the gastric emptying, but also you can say the gastric motility, as well as it inhibits the G cells, that is the gastrin producing cells. It goes via the vagus and it inhibits the G cells. Okay, so that's how this is known as enterogastric reflex, right? Even if you do not know anything about it, you can easily know that yes, it is from the duodenum going towards the gastric. Obviously this should be enterogastric. Gastrocolic is different. It is starting from the gastric area, that is the stomach, and it is going towards the colic, that is the colon. This is for the emptying of the you can say the previous food particles or the waste material that was there from the previous meal. As soon as you eat new food, the previous food should be get out of your GIT from the feces, and that is done via this both things, that is gastroileal ileal and gastrocolic. They increase the motility. As soon as the food goes in the new food goes in the stomach, the previous remnants of the previous meal, they start getting out of these area, and the contractility of these two area will increase. Now the myenteric plexus, it's plexus, it is present everywhere, right, except the esophagus and proximal part of the stomach. It is having no relationship with this particular scenario. Let's move on to the next question. Answer, guys. Multiple sclerosis, conduction of the motor and sensory pathway is due to. This is not per se related, but yes, multiple sclerosis may you should know what is the pathophysiology. I'll tell you that the antibodies are formed, and the antibodies are against something which is related to the answer over here. Yes, guys. Question 5th, answer. Yes, Hemal, you were super. Forward feedback. I just now read. Yes. So antibodies are creating against the myelin sheath, right? And if the myelin sheath is gone, we know it acts as an insulator for the membrane of the axon. It does not allow, suppose this is the myelin sheath, yes, so it does not allow the sodium to leak out from the membrane. So it is kind of the increasing the resistance of the membrane, not of the flow, mind you. Okay, it is increasing the membrane resistance of the axon. Sodium cannot leak out through this. So what happens, directly it goes in this area, right? So it looks as if the action potential is jumping from one area to another area because the membrane resistance is high because of this myelin. But the problem is that in the multiple sclerosis, these poor patients, they do have antibodies against this myelin sheath, and that's why their myelin sheath will not be there, and that's why there is a loss of myelin sheath, and the motor and sensory pathway, they are going to have a slower conduction because the sodium will leak out through these area also, which is not happening in the normal patient, normal subjects. Now, I don't know why this is in physiology, but if the question is there, you have to solve it. Please solve this question also. NO, that is nitric oxide, is synthesized from. Yes, guys, answer please. फटाफट से आंसर देंगे. Easy question. Missing Ashish sir, yeah, he is busy, kind of a busy in another schedule. He devoted himself to some other classes, right? I hope I can give you my 100%, right? Yes, Divya Bharati Patil. Okay. Okay, good. Thank you. Okay, chalo, answer I got from many people, that is L-arginine. That is correct. Okay, so it is kind of a biochemistry question per se, but we cannot say anything. If the question is there, we have to solve. That is our final aim, right? You are correct. Now, can you tell me where these are formed? In which layer these are formed? Intima, media or externa? Yes, please. Remember, we don't have time, we are short of time, so I'll tell you the answer, that this is produced, the NO is produced in the media, right? We do have layers of the vessels. In the media layer, we are going to have this NO production, but it acts on the intima layer also, right? Thank you guys. Thank you so much. You guys are giving me the energy because you are replying so nicely. You are interacting so nicely. See, if you are giving me the energy, I should give my 100%, right? Let's move on quickly forward. Proteoglycan present in the glomerular basement membrane. They should not ask per se the factual question in the physiology, because physiology is a core concept, core subject of the concept. But yes, since they ask, I would like to show you. I made a chart for you guys. Okay, just have a screenshot shot of that, and I can say that we can move on. Now, what do you think the answer over here? What do you think the answer over here? You can see over here the GBM, that is the glomerular basement membrane. It is pure factual question, right? So please get to know that 10% of such question together in all the all the subjects, 10 questions will be factual, which even we do not teach sometimes in the class, right? So that's why the session is there for you guys, right? So it is not heparin per se, bacho, it is heparin sulfate. Okay, that is heparin sulfate. So please have click this picture, since it is asked last time also. So yes, they can ask again, so we should be prepared from our side, right? So the answer over here is heparin sulfate, right? Chalo, let's move on. This is nothing to discuss over here. Factual question. We are not going to waste time. Now, this is the interesting question. Clotting factor, hematology, blood physiology. Yes, please. Warfarin therapy would be decrease in the gamma carboxylation. Yes, you should, we know that gamma carboxylation or gamma carboxyglutamate, which occurs after the gamma carboxylation. You must have studied this in the biochemistry also. Yes, guys, please answer. Okay, I got one answer from Dr. Rahul. Yes, Abhi, right, Hemal, yes. Superb, guys, superb. If you would have given the exam of 2020, you would have got 100 out of 100. Factor 2, superb, guys. So gamma carboxylation, for that we require a specific factors. We know that it is nothing but 2, 7, 9 and 10. 2, 7, 9, 10. Where the 3, 7, 9, 10 comes, Soumya, awesome, Divya, Lakshmi, Rathod, Dr. Nasira, awesome, guys. Balaji, Harry Potter, oh, nice. Krishna, Shiva. Awesome, guys. Awesome. So this is 2, 7, 9, 10, right? So these are the factors which help in the gamma carboxylation. 3, 7, 9, 10 comes in the parasympathetic, right? So correlate with that. Okay, water hammer pulse. Very easy question. We discuss often in the physiology, in the CBS physiology specifically. Yes, guys, answer. The answer of this question, I already got the answer from Golden Dreams. Oh my goodness. Look at that. Dr. Nasira, superb. Aortic regurgitation, yes. Nopala. Soumya, Abhi, awesome, guys. Awesome. So, aortic regurgitation is the answer. Now, what happens in the aortic regurgitation? Simple diagram. Very simple diagram. Suppose this is the aorta and this is the left atrium, and suppose this is the left ventricle. Okay, now what is going to happen? There is a valve over here which is unable to close whenever it should be closed. Now what happens? Whenever the ejection happens, quickly one upstroke will come. But when we are checking this on the aorta, suppose the transducer over here, right? Whenever we are going to check that in the aorta, what is going to happen during the diastole? These valves should be closed, which are not able to close right now. And as soon as the ventricles will start to relax in the diastole phase, the blood will flow forward also and backward also. So quick emptying of this aorta will take place. Why? Because most of the blood is coming back in the left ventricle as the ventricles start to relax, right? And that's why this seems as if somebody is hammering very quickly onto the you can say some object, right? So that quickly, that rapidly, the wave is going to go on the downside, and that's why it is known as water hammer pulse, or one more name, collapsing pulse. As if it looks like the pulse should be reduced slowly and slowly. Why? Because if this valve is closed, the blood will not come backwards or it will not regurgitate. Rather, slowly and steadily, as the aortic recoil happens, it will go forward and it will give us the diastolic blood flow. But over here, since the back pressure is occurring and the regurgitation is occurring, it seems as if the wave is collapsing suddenly, right? And that's why it is known as water hammer pulse or collapsing pulse. Next question, yes please. With the Mulai, not yet, but yes, definitely I will have. Okay, Divya Bharti, superb guys. Hanji, next question please. 65-year-old lady present with the vascular injury to the inferior frontal gyrus. बस इतना ही देखना है हमें, और कुछ देखना ही नहीं है. We got the clue. Inferior frontal gyrus, which functional area mostly be affected? Yes, please. Two areas you need to remember, right? 100%. If you don't know, just remember that these are the two areas which you must remember. These are the two areas. Which are these two areas? Broca's area and the Wernicke's area. Broca's area and the Wernicke's area, right? Broca's area in the Hindi. I don't know how many of you are understand Hindi, but this is the conversation that's how I used to remember. Broca's, B means Broca's area, B means bolna. For the bolna, that means to talk in Hindi. Bolna, that means to speak anything, you need to use your facial muscle, the tongue, which is the muscular organ, right? You have to articulate your tongue. So that's why this is the motor area. Remember, bolna. For the bolna, that means to speak, you need to use your motor skills. Okay, so this is the motor area. Now, what we do over here? What we do in the superior temporal gyrus, that is the Wernicke's area. Now, as I'm talking, right, as the screen is there, you can read on the screen, right? So how this is happening? You are understanding that language, whatever is projected on the screen, you are understanding that question, right, with the help of this Wernicke's area. Thanks to the Wernicke's area, that whatever I'm speaking and whatever you are looking at this slides questions, that you are able to understand, you are able to comprehend thanks to this Wernicke's area. Now this Wernicke's area is connected to this Broca's area with the fasciculus, which is known as arcuate fasciculus. Right now, this comprehension is going towards your Broca's area and you are giving the answers. I mean, I hope you are giving at the answers. You are writing it, but if you are speaking in the live class, then that must be your Broca's area. So two areas, just remember you. And if you do not remember, even look at this diagram. You know, pre-central gyrus. Okay, let's change the color. Pre-central gyrus, it is usually for the motor, right? Okay, this is the motor area, it is written over here, right? And the post central gyrus, we know just behind the central circus we have sensory area. So this is connecting with this Wernicke's area also. So that's how you can comprehend, or that how you can connect two informations, right? And you have to remember. Now I told you that this is the sensory area. So if the aphasia occurs, if the lesion occur at this area, definitely this aphasia will be known as sensory aphasia. Sensory aphasia, remember, the person is able to talk. He will talk nonsense, right? You're not able to understand what he is talking because he's not understanding whatever is spoken or written language, right? He's not able to comprehend, but he's able to talk. So he will talk fluently, but with no sense. So that's why it is known as, first thing, sensory area is affected. So sensory aphasia, and this is fluent aphasia since the motor things are not affected, right? If the motor area is affected, that is the frontal lobe. Which area of the frontal lobe? Inferior frontal lobe, right? Then definitely, obviously, he will able to comprehend, but he'll not be able to talk fluently, right? Because the talking is affected, the motor area is affected, and that's why he is going to have this something known as non-fluent aphasia, or definitely the motor area is affected, so motor aphasia. Why we are giving so much time into this? Because remember, these questions are asked in the INI-CET also, NEET also, in all other exams also. So please remember this. Again, next time this question is going to come, you'll give me the answer very quickly. Yes, Himal, right? Ganesh, super. Harry Potter, first thing, I like your name. Okay, fine. So yes, definitely the answer over here, yes guys, as you told me already, that is motor speech. Motor speech is going to get affected, right? Not Wernicke's area. Over here the Broca's area will be the answer, right? Visual area is not affected at all, auditory also not. Okay, now a boy met with a motorbike accident. How many people are meeting accident? Okay, CT of the brain is done, right? Posterior end of superior temporal gyrus. Here we comes. Now you give me the answer within a fraction of second. Don't think about anything else. Superior temporal gyrus. Just now we read. Yes, please. Superb. Nopala, superb. Yes, please. Answers, guys. Rahul, superb. Harry Potter, Soumya. Yes, all of you. Dipti, Mulai, right. Golden dreams. Yes, the dreams will come true someday. That is fluent aphasia. No need to waste any more further time, right? Let's move on to the next question. pH 7.2. What is the normal pH of the blood, right? That is 7.35 to 7.45. Okay, or it is written as 7.4 plus minus 5.5. Okay, now if it is decreasing less than 7.35, we are going to say it is as acidic, right? And if it is more than 7.45, we are going to call it as alkaline, right? So definitely there is acidosis. So this is not the option, this is not the option. Over. Now remember, there are two types of this acidosis and alkalosis. First is respiratory, second is metabolic. Now in the respiratory, we are going to check CO2 levels, which is indicating the acidicity in the respiratory system, and over here bicarbonate, which will depict the alkalinity, or we can say this is the alkaline indicator of the metabolic processes, right? So if suppose the CO2 is increased, then definitely it is the respiratory acidosis. If the bicarbonate is decreasing, then it is the metabolic acidosis. Now what are the normal level of PCO2 and bicarbonate? Look over here, it is 10 over here in this scenario, but usually it should be 24 to 28 milliequivalent per liter, and this should be around 40 mmHg, right? Over here what you are seeing is the bicarbonate is decreased. The bicarbonate is decreased. That means what we discussed, bicarbonate is decreased, and we know that this is acidosis, and that's why the answer, yes guys, answer, yes, I got the correct answer. Superb, Nasira. Vivek Kumar, why not sensory aphasia? बच्चे sensory aphasia में ना there are 2-3 things more also. If the whole of thing is gone, we'll discuss that in some other time, right now just give me some time over here for the other areas. Remember that the sensory area is sensory, sensations are depending on many things. Other area try to compensate for that area. For now just remember that. Okay, we usually discuss that in the classes. Yes. Okay, sensory aphasia may some sensations are lost. If you have both the things in the options, then better option will be that, right? You guys are asking why not the sensory aphasia, because remember what they are going to ask is the fluent aphasia is also there. The better answer is fluent aphasia, because the sensations, some other areas are gone, then also we call it as sensory aphasia. So there is one addition over here of the additional regions, and if the sensation of few areas gone, other try to compensate with the help of plasticity. Okay, so if both the things are in the option, for now just trust me that the fluent aphasia will be the correct answer, because the sensory aphasia can be said to other areas are gone, because they also try to compensate or involved in this sensory aphasia. Okay, chalo fine ji. Metabolic acidosis. Okay, over here what we learn is this is decrease, so definitely it is the metabolic acidosis, right? Option C is the correct answer over here, right? Respiratory acidosis. Now what we are seeing, the CO2 is the acidic indicator, that should be increased if there is a respiratory acidosis, but over here what we are seeing is that it is rather decreased. That means the respiratory system trying to compensate our metabolic acidosis. It will throw out more acid, that is the CO2, and that's why reducing the acid levels in the respiratory system, it tries to maintain the condition, or tries to compensate, help our metabolic system, right? Let's move on. In which of the following condition would be the cortisol level highest? Yes, please. Answer. Next question. Answer, please. बच्चे, it is secondary. Respiratory तो हो नहीं सकता है ना. Respiratory acidosis में what should happen? Nasira. Respiratory acidosis में the acid should increase, but over here the acid is decreasing. It is not more than 40. It is 30. That means it is less than 40, right? And it is the acid, indicator of acid. If it is acidosis, then it should increase, but over here rather it is decreasing, right? So it cannot be the respiratory acidosis. Okay, bache? Chalo ji, I got the answer from you guys. See, Addison, nothing to do with the increase of the cortisol, right? Aldosterone ka decrease hota hai. So no, that cannot be the answer. Now, when you give a normal person, the dexamethasone, the intrinsic, the endogenous production of the cortisol will rather decrease. Why? Because the homeostasis, it should maintain, the body should maintain the cortisol in a normal level, right? So if you give exogenous cortisol, obviously in the normal person, is having no lesion in any area, the endogenous secretion will decrease. So this cannot be the answer. And yes, definitely due to the diurnal, you can say the release of this cortisol, this happens that after waking up in the morning, that is 6 to 10 a.m. the cortisol levels are high, as well as 6 to 8 p.m. the cortisol levels are high. I hope your levels are still high, right? Let's move on. It helps in the coping up with the stress. Let's move on to the next question. 55-year-old present with the tachypnea, mental confusion, blood glucose. Oh my God, look at the blood glucose and look at the pH. What we talk about the pH. If it is less than 3.5, that means definitely it is the acidosis. No question of alkalosis at all, and it is 7. Right, that means less than 7.35, definitely it cannot be acidosis. Why are looking at this Dr. NP, cortisol levels are increases, that question, that mechanism is hidden in the evolution. When we are evolved, during the evolution, we were animal beforehand. So animals, what they do is they go towards for the, you can say, hunting in the morning, right? And that's why their cortisol levels should be high. And from then them only we evolved. So that's how our cortisol levels are also high. From sleeping, we are changing our phase to waking up, right? And that's why we are dealing with the new stressors, and that's why our body should be prepared for all the stress, and that's why the cortisol are high in the morning. Okay, diabetic ketoacidosis. Mwah! Awesome, guys. So blood glucose, obviously that is the hint. It should be less than 250 even after the meal. But over here, the diabetic ketoacidosis is there. There is no question of alkalosis whatsoever. The pH is less than 7, right? So definitely it is a kind of a respiratory acidosis. Respiratory acidosis. Why? Metabolic acidosis, not the respiratory acidosis. It is the metabolic acidosis. Obviously the metabolism, the gadbad is in the metabolism, the lesion is, the problem is in the metabolism of the glucose, and that's why the definitely over here the answer is metabolic acidosis. DK, right? Harry Potter, Arun Sheikh. Okay, Medha, superb, guys. Next question. Yes, CPD. हाँ जी, पैथो में भी पढ़ा है आपने. CPD is better for the hypoxic patient than the acid citrate dextrose because yes please, because. हाँ जी guys, answer please. Yeah, I got the answer from Soumya, Balaji, Lakshmi, Nasira, all of you. Awesome, awesome. The answer is option C. Now remember, the only one thing, that is 2,3-DPG is less, right? Now what happens is 2,3-DPG, hypoxic patient we are dealing with, right? So we need to give more and more oxygen. Remember, this 2,3-DPG and this oxygen, they fight for one chair. That one chair is hemoglobin, right? If the 2,3-DPG is higher, they will go and sit on that chair. That is nothing but the hemoglobin. That means they will bind to the hemoglobin. Okay. If the oxygen is more, it is going to bind to the hemoglobin. The only difference over here is 2,3-DPG, which is less in the CPD. Let's move on. Next question. हाँ जी, थोड़ा सा tricky question है, a little bit tricky question, but I know that you will solve it. Take your time, but solve this question on your own. When the VQ is infinity means what? Now, VQ. V means air coming towards the lung for the exchange. Let's write in the lung for the exchange, right? And the Q means blood coming towards the lung for the exchange. Oh my God, that is so easy, right? Very, very, very easy. Now, when the infinity will occur? Yes, please. Okay, I got the answers already. Yes, right, all of you. Love you guys, love you for this. Okay, so if you're giving this question correctly, that too within seconds, so you're definitely going to get more time to solve medicine questions, patho questions, and surgery questions, right? So dead space. Now look over here, concentrate over here. So yes, please, this is the V, the air coming towards the lung for the exchange, and this is the Q, the blood coming towards the lung for the exchange. Now if I say the denominator is 0, that means anything upon 0 will give us the infinity, right? That happens in the dead space. Dead space means the space till from the trachea. Let's write it over here. Just give me a minute. Trachea towards till the terminal bronchiole. We call it as conducting zone or dead space. Why? Because there is no exchange possible and no blood coming in that area for the exchange, right? And that's why if the Q is 0, denominator is 0, definitely the value will go towards infinity. And that's why it's simple, very simple answer over here is the dead space. Okay, chalo ji, aage badhte hain. Okay, next question. C wave in the JVP is due to, hanji. Again, INI-CET, November 2021, same question was repeated in somewhat different manner. They asked about the phases of the this JVP, the isovolumetric, the closure of the different valve, right? But yes, JVP is asked usually. There are 2 descents and 3 waves, positive waves. Okay, superb guys, superb, superb, superb. So, how to remember? There are 3 waves, that is positive deflection, A, C and V. A for atrial contraction. A for atrial contraction. C is because of bulging of the tricuspid valve during the isovolumetric contraction phase. Now, what we do in this JVP, we are going to attach on the jugular vein, we are going to attach what thing? We are going to attach a pressure transducer. Now, since in the right atrium, suppose this is the heart, I don't have much of the time, so I'm just trying a very simple symptomatic diagram, right? Now, there is no valve present whatsoever in between the jugular vein and the right atrium. So, both are going to have the same pressure changes, right? If the pressure increases in the right atrium, then the pressure also going to increase in the jugular vein also, right? Rather than putting the pressure transducer, which we cannot do in the right atrium, so that's why we put it in the jugular vein, and that's why we call it as jugular venous pressure, which is actually depicting the pressure of right atrium, right? So definitely whenever during the whenever the ventricles are contracting, they start contracting, the valves that that are between the AV valves over here, they are going to bulge into the right atrium. Definitely the pressure inside the right atrium, it is going to increase. The pressure inside the jugular vein is going to increase. Again, the positive wave, right? X. Whenever the ejection occurs from the atria, what is going to happen? The atrial emptying will occur, right? And that will give you the X, that is this. And whenever the venous return occurs, at that time, again the venous return will fill the ventricles over here, right? And that's why again you are going to get a positive deflection. The atrial emptying, that will give you the what thing? Y wave. Okay, chalo आगे बढ़ते हैं quickly. In preterm baby with the respiratory distress syndrome, okay, just now you guys told me lipid would be deficient. हाँ जी, lipid कौन सा deficient होगा? The major lipid over here, Yes, Ganesh was right. Right. V is Venus. Venus written bache. We talk in terms of atria. Ganesh, you're right. Awesome, guys. Awesome, awesome, awesome. So we check L by S ratio, that is lecithin, or this lecithin is also known as DPPC, that is dipalmitoid phosphatidylcholine, which is the major surfactant. Major surfactant. Remember, in the alveoli, what we see is that when we are born, there is a layer of water which is going to be present. And you know, as the physics of how the raindrop is formed, they're having the inward force, a unity they want to show, right? So that's why each of these molecules put inward pressure, that is nothing but the surface tension. Now, where the surface tension will present? Wherever there is air water interface, wherever there is air water interface. Now, our body does a trick mechanism. It knows that whenever you put the, you can say the lipid into this on the water surface area, it will loses is that inward force wala action. So what the body is going to do to this water is that it is going to apply some molecules of lipid over here. Some will be major, some will be minor. So that's why their forces will be reduced. Their forces will be reduced, right? Now, these are nothing but your surfactants. Some are major, some are minor. The major one is GPPC, which is also given a short nickname, that is the lecithin. Lecithin and the DPPC is one of the same thing. Just a nickname, short, cute nickname. The another one is the sphingomyelin, which is the minor one. Now, you take that ratio in the gynae. If it is equal to or more than 2, that means it's good, right? The lecithin should be more. The numerator should be more, right? If the numerator is less, what will happen to the ratio? The ratio will decrease, right? The sphingomyelin tries to compensate that deficiency of major surfactant, but it won't be able to do that much of the function. And if the numerator is increasing, definitely the ratio will decrease, which is not good for the baby. Okay, let's move on. Impaired function of aquaporin resultant. So simple. Aquaporin are present in the nephron, especially in the DT, that is the distal tubule. We call it as the combination of DCT as well as collecting tubule, not the collecting duct. Collecting duct, usually the duct, when we say, it means it just collects the urine. Okay, answer please. Yes, Sarath. Yes, you were also right. Oh my God. Look at this interaction. I'm loving that energy. Yes, guys. Awesome, awesome, awesome. Sarup Mandal, one of the new name. Awesome, guys. Awesome. So yes, definitely it is nephrogenic DI, right? If the aquaporin, if there is a problem in the nephron, definitely what is going to happen? Definitely there will be the DI. That means the aqua, as the name suggests, aqua means water, porin means the pores or the doors for the water to welcome the water inside the blood, right? If they are not working properly, definitely the water will not be absorbed, and that's why the diuresis occur, and the problem is in the nephron, not in the pituitary. Now, can you guys tell me one important question recently came in the 2021 exam, that if I say central diabetes insipidus, the problem should be where? Hanji, aquaporin work under influence of ADH. Chalo, hint bhi de diya. Now, you guys tell me from where the site of production. Site of production of this hormone. I'm asking site of production, not the site of release. So answer please. Site of production. Yes, please. Extra question. Hanji. Nasira beta, that's why I told you, Dipti, again think about it. Site of production I asked, not the site of release. Two different answers. If I ask site of secretion, site of release, the answer will be different. That you guys are giving me, that is the posterior pituitary. I'm asking site of production. There are only two hormones which are not produced in the pituitary. Remember that? Hanji. Yes, I got a right answer from Harshil. Yes, now you guys are coming right. Sara, Yuvraj, Soumya, supraoptic नहीं बच्चे, वो regulate करता है. That is not going to kind of produce, but yes. Okay, चलो, good. So yes, definitely. If they ask site of production, remember there are two hormones, oxytocin, paraventricular hormone, and as you guys told me, supraventricular nucleus, right? Where they are produced, where they are present, they are present in the hypothalamus. So if they ask, both were in the option. So that's why I told you beforehand, concentrate on the question, okay? Site of production, the answer will be hypothalamus, and if they ask site of secretion, release, whatever, then the answer will be posterior pituitary. Any of these, if they are having the problem, definitely it will be central DI. चलो आगे बढ़ते हैं. Vitamin B12 is found in, oh my god, चलो बताओ. अगर आप गए प्राइमरी हेल्थ केयर सेंटर में, if you are posted in the primary health care center and you find out that vitamin B12 is deficient in a particular patient, usually they are females, right? What you're going to suggest them to eat? हाँ जी बच्चों. Good. Nasira, awesome. Yes, Soumya, Abhi. Right. You will definitely save that patient with telling the right answer, that is the animal products, right? In the vegetable, in the leafy vegetables also it is present, but in a minute amount, very little, right? Which is not sufficient to produce that or compensate that deficiency. So yes, definitely the animal products. Next question, guys. 50-year-old man present with paresthesia, hemoglobin is less, peripheral smear is showing microcytes. That means definitely it is somewhere dealing us with the megaloblastic anemia. Again, hypersegmented nuclei reveals atrophic gastritis. Hanji bacho. See, hypersegmented nuclei, as we learn in the blood physiology also, they can be present in two scenarios, that is folic acid deficiency and vitamin B12 deficiency. Now, but another hint the examiner is giving us, yes, right? Yes, we saw the diagram also. Oh my goodness. Wow. Right. Awesome. So yes, I'm getting the correct answer, that you know that if it is telling you about the gastritis, anything related to the stomach, that is definitely is going to affect vitamin B12. Folate as this folic acid has no relationship whatsoever with the stomach, right? So definitely answer over here, because of he mentioned the gastritis over here. That is the second hint. First hint was this megaloblastic anemia with the hypersegmented neutrophil, which can be present in the folic acid, but no relationship with the stomach. So that's why the answer will be vitamin B12. Next, transplantation between identical twins. Hanji bachcho. Identical twins. Xenograph from the strange person, or we can say strange animal, right? So different species, that I'll rule out. Hanji. Baki batao. Auto means self. Auto means self, right? Allo means similar but same species, but allo means same species but a person is different. Okay, definitely yes. Iso means identical. Iso means identical over here, right? From the same species, from the same genetic material. So the answer over here is isograft. Let's move on to the next question. 42-year-old patient present with the symptom of premature aging. Diagnosed with the Werner's syndrome. PA movie, if you have remember, right? The most likely mechanism, Hanji Bachcho, please bataiye. What can be the mechanism over here? Werner syndrome mein, what is the problem? The cell is getting very quickly, you can say, reproduce, and the age span or lifespan is very short of that particular patient. The PA movie, PAA, was on that, based on that Werner syndrome. The quick aging is there, right? Superb, all of you. Even I cannot read the name, that quickly the answers are there, and I love your energy, guys. I love your energy, right? Short telomere, right? Telomerase is acting a lot, and there is a loss of helicase, and definitely it is going to lead to a short cell cycle, right? If the cell cycle is short, it is going to proliferate quickly, it is going to degenerate the cells quickly, and that's why the premature aging will take place over there. That we learn in the genetic physiology. Definitely you learn that in the biochemistry, wherever and especially in the patho we used to learn, and definitely whatever it is there, it came in physiology. So my this thing is there, that responsibility that the correct answer should be given. Right, next, टायरोसिन काइनेज. हाँ जी, जो भी बच्चे मिस कर रहे थे आशीष सर को, राइट, ही यूज्ड टू गिव अ वेरी नाइस न्यूमोनिक, दैट इज द डर्टी पिग. हाँ जी, टायरोसिन काइनेज. Receptor. See, receptors again, in the GANOG there is one more pathway written as JAK-STAT pathway. That is a pathway, remember. Okay, that is the pathway, that is not the receptor. Over here the receptor is asked. Hanji, answer bacho, answer. I got the right answer from Sarath. Yes, Sheetal also, Vivek Kumar, right, Sarath, Mulai. Dirty pig, yeah. Okay, so what is this dirty pig? TY is tyrosine. TY for tyrosine kinase. Let's move on quickly. I don't have much of the time. So P is for prolactin. The prolactin, the receptor also contains some amount of tyrosine kinase. It is not entirely made up of tyrosine kinase, but yes, insulin is the hormone which works on the entire receptor, which is based on this tyrosine kinase, which is insulin, and this is for growth hormone and growth factors such as VEGF, PDGF, right, fibroblast growth factor, the erythrocyte growth factor, the thrombocyte growth factor, which are known as EPO, and thrombopoietin, that is erythropoietin, thrombopoietin, right. All these growth factors, they are nerve growth factor. Yes, B. Rasul is so active, he is typing so nicely. Yes, dark treading also, oh my god, different names. So yes, but remember the prolactin and this growth hormone and growth factor, they do have other contents in their receptor also. So if they also are in the option, you are not going to go unless and until the insulin is not there in the option, right? And they work through the JAK-STAT pathway. Insulin has its own pathway, right? Two things different. The receptor is different, and whatever the pathway is going on, whatever the metabolism is going on inside, that is different, totally different. Remember that. So some part of this tyrosine kinase is also present in these two receptors also, but since it is not in the option, there is no question of that. Let's move on to the next question. Serum prolactin levels are highest. Hanji bachcho, highest kab honge highest? When they are going to be highest? Yes, युवराज सिंह, आपने छक्का मारा है. Cell surface receptor, you were right. Mulai, yes, I do have a group which is known as Medifund Tales. You can join that group, but yet I did not started it properly. Praveen Kumar, everybody. Oh my god. See, look at that. So nice, so nice. That means you read gynecology very well. Chalo. Serum prolactin levels are highest. We all know the prolactin is going to be highest after 24 hours after paturation. REM sleep mein, the prolactin per se is not having any role, and they do not even mention male, female, whatsoever when the estrogens are high. Estrogen also per se is not related to the prolactin, right? So definitely the answer over here, the clear cut answer over here is 24 hour. And that's how we completed the first question paper. Welcome you all again in the NEET PG 2019. This will be more easier, right? You cross a bit difficult battle. Now let's fight with the less difficult battle, easy battle. Okay, chalo, answer. Peripheral chemoreceptor respond to hypoxia using which channels? Again, the hint I'm going to give you is glomus cell, which is having something known as oxygen sensitive dash channels. That dash you have to fill, which will, whenever there is a hypoxia, they're going to get close. And as soon as they close, there will be depolarization, and then the action potential will be formed. Okay? Hanji. हाँ जी, yes yes yes, चलो गुड 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 गुड। बच्चे ए नहीं होगा, आर एन, आर एन, थिंक अगेन बच्चे, आई वॉन्ट ऑल ऑफ यू टू गिव राइट आंसर्स। कैल्शियम नहीं होगा बच्चे, यस, कैल्शियम तो सभी में होता है। द कैल्शियम, दे आर नॉट गोइंग टू respond specifically to the hypoxia. The calcium channel respond to voltage, remember, not to the oxygen. Yes, calcium channels are also present, but they are going to respond to the voltage, not to the hypoxia. Bache, chemoreceptor, we are talking about the chemicals, and the chemical over here is the oxygen, right? So answer, as you guys told me, as you guys taught me today, that be energetic, more and more energetic, that is the potassium channel. Now potassium channel, usually if we take any cell, potassium channel usually more outside except the ear, that is the endolymph, except that, just remember for now that in the endolymph the potassium is more outside and less inside the hair cells, right, because of stria vascularis. Then that is the only one exception, otherwise the potassium is more inside the cell. So whenever you are going to open up the channel, what is going to happen, the potassium will move outside. If the potassium will move outside normally, and what I told you, as there is a hypoxia, what is going to happen, the potassium channel will be closed and the potassium will not be able to go out. It is a positively charged ion, will accumulate inside the cell, and if it is accumulating inside the cell, definitely it will cause depolarization, and hence the action potential will move forward. The answer over here is option C. Okay bacho, yes, they are having the calcium channels also, but they are sensing the voltage, not the hypoxia. Okay, चलो आगे बढ़ते हैं। वेजोप्रेसिन, वी ऑलरेडी नो दैट। हाँ जी बच्चों बताओ, चैनल्स इन द कलेक्टिंग डक्ट एक्टिंग ऑन विच चैनल्स? हाँ जी, वी से देयर आर 3 रिसेप्टर्स। आंसर बच्चों, आंसर, not the chloride channel, Rahul. I hope you understand now. I'm happy that you are responding. Do the mistakes over here, but don't do it in the exams, okay? Amita Ditya, please think again, bache. It's not D. It's not D. Not D, bache. D for dog. That is not there. Amita Ditya, think again. You are writing the D answer again and again. That is wrong. Aquaporin 3 are not there. Aquaporin 2 are there. Right? Collecting duct mein aquaporin 2 are there. Vasopressin. What mnemonic we tell? See, vasopressin means ADH, right? Again, the fancy name of antidiuretic hormone is vasopressin. V1, that is going to be there, and it helps in the nephron to maintain the GFR, right? Via acting through the IP3DAG, acting through the IP3DAG, and whenever it is going to act through IP3DAG, it is going to increase the calcium. This calcium will act on the afferent and efferent arterioles, and it maintains its contraction or relaxation, right? And that's how it helps in the maintenance of GFR. The V2, it is going to increase, it will act through cyclic AMP mechanism or secondary messenger, and it will maintain or open up the aquaporin 2 channels. Aquaporin 2. So remember, V2 receptors, when the ADH will act on the V2 receptors, it is going to increase aquaporin 2, right? Not 3. Okay, now V3, or it is also the it is kind of similar to the V1, so some scientists also say it as V1B. Now it helps in the increase of ACTH hormone, which is not at all related over here, right? Chalo, the answer over here is definitely option B. Okay, don't do the mistake, Amitaditya. Okay, rest all of you awesome, awesome, awesome. I'm enjoying this session more than you. Okay, चलो आगे बढ़ते हैं. चलो देखते ही बता दो. Just have a look and tell me which group it is. No need to even read the question. No need to even read the question. Just look at the slide and tell me the agglutination is seen over here, not in this, not in this. So what it should be? Hanji. Anti-D, or we can call it as RH, small wala H antigen. Small wala H antigen. right? So if it is positive, no A antigen, no B antigen, right? Ganesh Roy, you're right. Dharma, right. Harshit, Amit Aditya, now you're right. Karola, Mulai, Vijay. Vijay, think again, bache, not AB, not at all AB. Vaishali, superb. So yes, it is O positive. See, no agglutination means no anti-B, no anti-B antigens, right? No over here there is in the second slide also there is no agglutination. That means no anti-A antigen, right? So yes, definitely there is no anti-A, anti-B, nothing. Just RH is positive. That means the O positive blood group is there. Now, next question, very, very easy. Golgi tendon organ. T for tendon. हाँ जी, T for और क्या है यहाँ पे? फटाफट फटाफट बताओ. Fourth, answer of 4. Question number 4. I'm seeing in my phone the delay also. Vaishali, awesome yaar. Your speed is awesome. Yuvraj, think again. I'm giving you the hint also, bache. Yuvraj, think again. Yes, all of you, awesome, awesome, awesome. चलो, आपने बता दिया जी, हमने मान लिया. Right? You told me and I agree with you completely. T for tendon, T for tension. There are two, you can say, sensitive organs which are present in the muscle. First is the muscle spindle. Let's change the color. Muscle spindle. And the second one is Golgi tendon organ. T for tendon, T for tension. Right? And the muscle spindle, it sense the length. It is the length sensing receptor, length sensor you can say. And this Golgi tendon organ is the tension sensor. One more question came in recent, the last PGI exam, which is not no more there. INI-CET is there, but since INI-CET also having this part of the PGI question, so remember this, where they ask where this GTO is present. The option were muscle, tendon, junction of muscle and tendon, and in the bone. So remember this is present on the musculo-tendinous junction. Musculo-tendinous junction. Tendinous or tendinous? Tendinous junction. Okay. The correct answer was this. Not the muscle, not the tendon. Okay. Chalo. Aage. Thank you for the energy that you are giving me via the response. So I'm giving you the extra questions also. Hormone predominantly secreted after 14 days. Remember over here. After 14 days they are asking, not at the 14 day. हाँ जी, endometrium पे कौन सा hormone will act बच्चों? हाँ जी बताओ. Cardiotoxic medico. I don't know, bache. This is you have to ask to the DBMCI concerned authority. Okay, Hanji. After. Don't. RK. फिर से सोचो बच्चे. After बोला है. Right. Awesome guys. Awesome. Progesterone. After bola hai. If the question would have been the hormone predominantly increase on 14th day, then the answer could have been LH on 14th day, right? Not after, but they are asking after 14 days, before 14 days, estrogen is high, during, like before the ovulation, 8 to 10 hours, the LH will be higher, and after 14 days, only one hormone will be higher, that is the progesterone. Chalo, let's not waste any further time on this. Testosterone. Hanji. बहुत weird सा mnemonic है. If I give you, you'll laugh on me. So, yes, please. Testosterone is secreted by which cells? The weird mnemonic is given by my, friends, you can say, or the guys, so-called guys, cool guys. Hanji. Without the mnemonic, you are giving the right answer. Right. Vedic cells. Right. How they used to remember in our first year is, chalo bata dete hain. This Dick, or you, if you change the G to CK, that's how they used to remember. That's a very weird, I know, mnemonic, but yes, you can remember, right? That's how, when in the first year we used to remember by this. Chalo. So Leydig cells, awesome guys, awesome. Chalo, let's move on. With increase in age, which of the following is true for the lungs? Increasing age. जब हम लोग बुढ़े हो जाएंगे, what is going to increase in us with the age? Obviously the age is going to increase, but the age is not in the option. हाँ जी, क्या बढ़ेगा? बताइए. डार्क ट्रेंडिंग. चलो, थोड़ा हंसी मजाक होना चाहिए, राइट? Nasira already gave me the answer. हाँ जी. Okay, I also gave the answer increases, obviously. See, residual volume is also going to increase. What happens with the increasing age? Your elastin fibers, they get weaker. See, you must have known the socks, right? The way which we wear inside the shoes, right? That kind of socks, right? When you use those socks a lot, what is going to happen to those elastic fiber? They become loose. The same thing in the lung. What happens is when we are inspiring, expiring continuously, their elasticity will be weaker, right? And that's why they're not able to, you can say, contract back, recoil back, right? So that property is lost. And the compliance means distensibility or stretchability. Obviously, elastin is giving the inward force. If it is that is reduced, that means it can distend very well. So that's why the compliance is increases. The residual volume is also going to increase because recoil is one property with which we expire properly without any using any energy during our young age, right? Then mucociliary clearance is increases. Again, no, the dynein and those motor complexes are also become weaker, and this is going to decrease. Fibrous interstitium, that is going to increase. More damage will be there, more soot particles, more carbon particles. If any diseases are there, they will be converted to the fibrous tissue. So answer over here, as you guys told me very nicely, that option A. Let's move on to the next question. Functional residual capacity represent the volume of the air remaining in the lung after what? So very easy question again. I'm just going to discuss the volumes. Capacity you have to read by yourself, or we can discuss quickly also. See, already 9:25, 9 is over, so I need to discuss 2 more question papers. So this is the tidal volume. This is above. We are not including the tidal volume, that is IRV, and this is ERV, right? And this will be your residual volume. This will be your residual volume. So, and this both together, we are going to call it as functional residual capacity. And over here, okay, give me a minute. Over here, what we are going to have is, at this area, we are going to expire. This is the normal expiration phase, and this is the normal inspiration phase. So after normal expiration, we are going to have the FRC left as. After forceful inspiration nahi bache. Normal expiration is done. Okay. The forceful inspiration is this. After forceful inspiration, what you are going to have is the total lung capacity, or if you are just taking this, you can also say vital capacity. Okay, vital capacity, or if I take the whole thing, residual volume also, we can say vital capacity, let's say for now, or you can say total capacity. This is total lung capacity, not the FRC, functional residual capacity they are asking. Okay, that is ERV and RV. That happens after this point, that is normal expiration. Chalo. Next question, very interesting question. Tubulo-glomerular feedback. What it is going to control? Very, very interesting phenomena. Tubulo-glomerular feedback. Now, look over here. very, very carefully. Tubulo, that means the tubules are giving the feedbacks. The tubules, that is especially the ascending. Now, latest Ganong mentioned that very nicely, ascending limb of loop of Henle, then the DCT. If the ascending limb of loop of Henle is not in the option, then go for the DCT. The cells that I'm talking about is macula densa cells. Macula densa cells are present in the ascending limb of loop of Henle, the ending part of that. Remember, if the question answer option gives both the ascending limb of loop of Henle and this DCT, go for the ascending limb, clearly mentioned in the latest edition of the Genome. Okay, bacho? Previously we used to say DCT over here. I took this from the net, so don't go with that. Previously we used to say DCT, but now it is very, very clearly written in the Genome that it is nothing but the ascending limb of loop of Henle that comes near this. As you can see that this is the PCT going descending limb of loop of Henle, ascending limb of loop of Henle. The end part of ascending limb of loop of Henle, it is coming near this glomerulus, right? Whenever the sodium chloride levels are going to increase, it is going to sense that and it will release or stimulate the renin cells. Renin will activate the RAS system and also it is going to contract or maintain the contraction of the afferent and efferent arteriole, especially the afferent arteriole, and that's how we are going to maintain the GFR. We are going to maintain the GFR. They're asking that it controls, not what it is sensing. If the and that too, not the plasma sodium, not at all. Plasma से कोई relation नहीं है. Tubuloglomerular tubules का there is no relationship with the plasma. They're sensing everything in the urine. So this cannot be the answer. Tubular secretion, no. We are relating with the glomerulus, right? Feedback is sent towards the glomerulus. So very easy, we are maintaining the GFR over here, right? Awesome, guys. You guys are awesome. This batch is really, I'm loving this batch. Polyuria, definition, kya bolti hai? When we learn about the renal system, we know that when we say that this is the polyuria, Hanji, answer please. There are two definitions. First one is this, option C. Option C. I'm looking at new names. Sai Mobile also. Mobile. Okay. Chalo, good. Jagdish also. Good, Jagdish. The answer is correct. That is 50 ml per kg. That is polyuria. Or there is one more thing. That is if in a day, if you are losing 3 liters of the urine per day or per 24 hours. If you are forming more than or even is equal to 3 liters of urine, that is also called as polyuria. In some books, it is given as 2.5 liter also. If 2.5 liter is not there in the option, go for the 3 liters. Okay. Physiology books specially mention this 3 liters. Some surgery books, they say it as 2.5 liters. Okay. Chalo, aage बढ़ते हैं. True about decorticate rigidity. Now, you guys will tell me the answer of this. Corticate बोला है, cerebrate नहीं. First thing, where the lesion occurs, this question is already came, so that's why I put this diagram over here. Look carefully. When we say corticate, corticate, there is no E, right? Corticate, in that the flexion of this upper limb and hyperextension of the lower limb take place. And when we say E, right? Decerebrate, right? In that extension of everything, E, extension of everything, right? E for extension. If 4 E's comes, that means extension of both the limbs. That's how we used to remember. Remember the way you want, just remember that, right? Okay, now what happens in the decorticate and decerebrate? Because again and again from last like 5-6 years, they are repeating this question. So important topic, right? Cerebral cortex over here. Now look over here. We are talking about decerebrate posture. What happens over here in this is that we are removing this. The lesion is over here, right? In this, lesion is above the red nucleus. That is decorticate. Cortex is removed, right? Decorticate. We are just removing the cortex. Decorticate. Decerebrate. That means we are removing the red nucleus also. Now this red nucleus provide the signals to the flexor predominant, right? If the cortex is gone but the red nucleus remain intact, it is going to stimulate the flexors of the upper limb, and that's why the flexion is going to be seen. But in the decerebrate, this red nucleus is also gone. So that's why extension will be seen, flexors will not be able to get activated, and that's why I'll zoom it out. It is the stimulation that it is shown over here in the small circles, right? Now that's why the extension will seen. If you don't have that much of time to remember and then directly ask the question about decerebrate, what is going to happen? Just remember E, right? Decerebrate aaya, so the extension will be both in the limbs. Why? Because the red nucleus is also gone. The signals will not be able to come downward towards the flexors of the upper limb. Okay. चलो सो आंसर बताओ बच्चों क्या होगा इसमें 11th. Some people already told me the answers, but decorticate, that means the red nucleus is prevented, so rigidity that we talk about is less pronounced. Corticate, फ्लेक्शन ऑफ लोअर लिम्स इन नो रिजिडिटी. डिसेरेब्रेट डिकॉर्टिकेट दोनों में नहीं होगा. डिकॉर्टिकेट बेसल गैंग्लिया का रिमूवल नहीं करते हैं, सो दैट्स व्हाई देयर विल बी नो, दिस इज नॉट द करेक्ट आंसर. बेसल गैंग्लिया इज एक्चुअली इंटैक्ट इन दिस, सो करेक्ट आंसर इज ऑप्शन सी बच्चों ओवर हियर. ओके, I think this is the most difficult question yet. Now you guys are giving me the right answers. Okay, do the mistake. How many mistakes you want to do before exam? No complaints at all, but in the exam please mark it correctly. Okay, then our session will be accomplished. चलो आगे बढ़ते हैं quickly. Calcitonin, very easy. Calcitonin levels increased in, हाँ जी बच्चों बताओ. एक सिंपल सा चार्ट दूंगी मैं आपको. सीरम कैल्शियम एंड सीरम फॉस्फेट. Okay, now vitamin increases both the things, calcitonin decreases both the things, and the PTH increases this and decreases this. Now concentrate over here, I'm talking about serum, I'm not talking about bone at all. If you remember this simple thing, then definitely you are going to mark all the questions correctly. Hanji, I already got a right answers. Yes, Nasira was right, Vaishali right, Ganesh, Amrita is new name again, Saikiran, Carola, right, Alphase, right, superb, Abhi, Gauri, Doc, yes Doc, we all will be Doc, right, JY, superb guys. So you already are giving me the correct answers, but still remember that this is the table that we need to remember over here. Now what they're asking, levels are increased in. The levels are increased in which of the following? Hanji, which of the following? Now remember, if we need to increase this, what it is doing? It is decreasing the calcium. So if the patient is suffering from hyperparathyroidism, what is going to happen? Hyperparathyroidism, the calcium levels inside the serum is definitely going to increase. We need to decrease them. And who is going to decrease that? To compensate that, we need to increase the calcitonin so that it can decrease. That means it will take the calcium from the blood and deposit in the bones, right? Parathyroid does the opposite work. It will take the calcium from the bone and put it into the blood. Okay, so they are kind of a counteracting mechanisms they're having, right? Let's move on. Anterograde peristalsis, the fan of Sir. Again, very interesting diagram, but a slight change over here. So there are pseudo unipolar neurons on which the serotonin is going to act from the myenteric plexus. The serotonin it is going to release. It will release something in the back and some things in the front. Anterograde, that means forward will be the dilatation. Chalo, ek kaam karte hain. I'll change the color. Forward dilatation and in the back constriction. If that happens, definitely the food bolus, this is the food bolus, is going to be pushed forward. That is known as anterograde. In the front, whomsoever are dilating that is the main important part, that is VIP and NO. VIP and nitric oxide, they are going to dilate in the front, and out of that we are having the VIP over here. Serotonin does activate both of these things, that is anterograde also and retrograde constriction also. Over there we are having acetylcholine and 5-HT mainly. Okay guys, so answer is option D. Nasira beta, Change your answer, Gauri. Serotonin is not the correct answer, bache. Serotonin activates both the things. Okay, so we cannot say the serotonin is the correct answer unless and until the VIP or NO is not there in the option. If they were not there, then definitely we would have gone with the serotonin. Okay, now you guys are giving me the correct answer. Bain bridge reflex. This is the only reflex which causes what? Hanji bacho. We divide the reflexes into tachycardia reflex and bradycardia reflex. Tachycardia and bradycardia. The bradycardia reflexes, whomsoever are getting activated, they usually activate vagus nerve, which is acting on the SA node, right? So they causes the bradycardia, but this is the only thing which causes what thing? This is the only and one and only reflex which will cause tachycardia, that means increase the heart rate. That is the Bain bridge reflex. When you give the infusion of the saline, the right atrium is going to distend. The stretch receptor in the right atrium, suppose this is the right atrium, when we give lot of infusion, IV infusion, then that infusion via the venous return will come into this right atrium and this is going to stretch. Now this is going to release something known as the ANP, BNP and all, but before that it is going to, over there, the direct stimulation of the SA node, there will be a SA node which is going to be present, and because of that extra amount of volume, this SA node get directly stimulated and that's why tachycardia is there, right? Chalo, let's move on to the next question. C-peptide. Hanji batao. C-peptide is seen in which type of insulin? We already discussed that in the questions also. C-peptide. Okay, what is the role of C-peptide? C-peptide, jitna insulin release hoga, the number of insulin molecules are getting released, the same, exact same amount of C-peptide will be released into the blood, right? And that's why we use that for endogenous insulin levels. If suppose some diabetic patient comes to you, you want to know whether suppose you advise him the lifestyle modification with the insulin doses also exogenously, but you want to check whether he is actually doing the exercise or he's doing the exercise and that is working on your pancreas or not, I mean the patient's pancreas. Definitely you want to check his C-peptide if you want to check the endogenous insulin secretion, because they are released in the equimolar concentration, that means exactly same amount, right? And that they are present in the pro-insulin. Pre-pro-insulin, so suppose if I make two chains, that is A and B chain, A chain and B chain. Actually what happened in the pre-pro insulin, this is actually not separated, and this C chain, that is the C peptide, which is going to connect them together. So there is no separate chain, only one molecule of pre-pro insulin is present, right? Then what happens later on, as the pre-pro insulin, pre-pro, I'll just write I, is getting converted into pro insulin. During that time, the disulfide bond is formed between the A and B, and the C peptide will get detached from this. Okay, and that's how we get three different chain, A and B bound with the disulfide bond, and the C will be removed. That we call it as C peptide. C peptide. So answer over here, yes guys, answer over here is obviously in pro insulin, not in pre-pro. Okay, pro insulin. Right, superb. Chalo. Then, but we will finish up quickly, right? Later on, we are not going to discuss a lot. Chalo, batao. इसमें क्या है? FVC is 3.5, FEV1 is 1.5. 1.5 upon 3.5. हाँ जी, answer बताओ. It is somewhere around 40 to 45%, right? It is somewhere around 40 to 45%. Okay? 42%. Chalo. So if it is decreased, the FEV1 to FVC ratio is decreased in OLD, the answer is OLD over here. We are running out of time, बच्चों, ठीक है? 11:30. चलो इतना देर नहीं लगाएंगे. During exercise, rapid breathing possible by which center? Rapid breathing. Exercise जहाँ पे भी आएगा, VRG is going to get activated. Remember, DRG is having only eye neurons, mainly the eye neurons. right? DRG are having I neurons as well as E neurons. So remember, they are only and only activated during the exercise. So exercise in the question, if that is coming, definitely only BRG will be activated during the exercise. Okay बच्चों, चलो आगे बढ़ते हैं. Slow conduction velocity is seen in which of the following fiber? Erlanger and Gasser classification. हाँ जी, ये होते हैं आपके सेंसरी ए फाइबर्स, सेंसरी एंड मोटर, अगेन अल्फा बीटा गामा डेल्टा, सेंसरी प्लस मोटर, right? Alpha and gamma are motor, mainly motor. Alpha also causes proprioception also, so it is kind of a mix kind of fiber, right? Sensory are beta and delta. Delta causes fast pain, right? This is pre-ganglionic, this is post-ganglionic, right? Erlanger and Gasser classification. C are unmyelinated thin fibers. Definitely they will be having less conduction. And the answer here is option B. Yes, guys. Hello, Sapna. You joined late, bache? Chalo. Respiratory centers are stimulated by, again, respiratory centers mainly there are two centers, central centers, that is central chemoreceptors and the peripheral chemoreceptor. Now remember, the central chemoreceptor only can be stimulated by H plus ion, but this can be stimulated, and that too in the CSF, because the H plus ions in the blood, they cannot cross the blood brain barrier. But the interesting fact is that whenever this is decrease in PO2 also, oxygen, and increase in carbon dioxide also, right? This carbon dioxide being a gas, it can cross, right? With the help of water, it will form carbonic acid, H2CO3, right? With the help of carbonic anhydrase, and it is going to get converted into H plus and bicarb again. So it is ultimately going to increase H plus. So the best answer over here, both will be simulated. They did not ask about specifically about the PC or the CC. So best answer over here is carbon dioxide. Yes. Ajit, Vivek, Nasira bache, think again. H plus तो आंसर में ही नहीं है, so I think you must be telling me the CC वाला आंसर, right? Superb, guys. चलो थोड़ा सा बढ़ेंगे आगे with a little higher speed. Okay, 20, question number 20. All are true about the decerebrate posture. Now, decerebrate posture, we already discussed everything over here. Cerebrate, except they are asking flexion of the upper limb. What I told you about decerebrate, E for extension. They ask true except. So flexion of the upper extremity, that cannot happen in the decerebrate, that will happen in the decorticate, right? So answer over here is B. Chalo, let's move on. INI-CET 2021 July. November, already the videos are there on the YouTube or in the app, right? Then let's come off with the first question. Which of the following is not involved in renal autoregulation? हाँ जी, कौन सा नहीं involve होता है? Not involved. Remember, the renal sympathetic system fibers, they are not involved. You guys will tell me the right answer. I know that, right? हाँ जी, आगे बढ़ते हैं. RAS system, definitely yes, it controls the autoregulation. Myogenic reflex, that means whenever you stretch a muscle, it will contract back. That is the contraction of especially the afferent arteriole. आकांक्षा, साई किरण, फिर से सोचो बच्चे. साई किरण, you are giving me the wrong answer बच्चे. Balaji, think again. It's not C. Yes. Gauri, yes, you gave the right answer. Okay, so RAS, angiotensin, myogenic reflex, and tubular glomerular feedback, they all related to the autoregulation, but not the sympathetic system per se. Okay, now plasma clearance of urea, UV by P. U means urine concentration of the substance, right? Let's say substance is S, concentration of the substance in the urine, right? This is the flow rate, urinary flow rate. And this is the plasma concentration of the substance, right? Again, so what is the answer over here? What you like to tell over here? Suppose the urea is the substance over here. Let's write U over here, but then you will get confused. U answer kya hoga? Good evening, Satvik Raj. Satvik Raj. Hanji, I'm getting the right answer. That is the urea concentration in the urine in the mg per 100 ml. That is the deciliter. That means the concentration that it wants to give us. We do not take 24 hours or at all, right? And that too in the grams. Not that is not going to happen, right? So the correct answer over here is option A. Flow of the urine. They asked about what does it stand for? The plasma clearance of the urea, UV by ple, right? So basically the U, what does the U stands for? They wanted to ask. Okay, U stands for, that is gone over here. Anyways, चलो आगे बढ़ते हैं. Tetanus toxin. Tetanus toxin, it acts on the, yes, right, Gauri. Ashish Kumar, you were wrong, bache. Tetanus toxin, it acts on something known as snare protein. Soluble NSF attachment receptor protein, right? Receptor, RE is for receptor. So soluble NSF attachment receptor protein, which is helping us in the, especially in the nerve terminals or axon terminals, for the exocytosis or release of the neurotransmitter or release of any vesicle per se, right? Stand for asking U. Yes, I agree that they didn't give the proper questions, right? U stands for. Okay. So this is their mistake. I agree. So leave that up. Now next question answer batao. Yes, I agree, Aditya. Yes, right. So tetanus toxin is going to act on the synaptobrevin. Okay. They give just the kind of this NSF protein that I talked about. They give just the long form of it. There is no such type of protein, right? This is the group of protein. So all group of protein, this is not going to, the tetanus toxin is not going to act on NSF. That means all the soluble factor proteins, right? So this cannot be the answer. These all are snare proteins. But the tetanus toxin act on the synaptobrevin. The tetanus toxin is brave, right? That is going to act on synaptobrevin. And you guys are brave too, that you are holding on with me till now. Okay, chalo. Hi Nadeem. चलो आगे बढ़ते हैं. नेक्स्ट क्वेश्चन बच्चों. अ बॉय प्रेजेंटेड विद इंट्रैक्टेबल डायरिया आफ्टर द बीच ट्रिप. ओके, राइस वाटर. ओके, स्टूल ऑफ द राइस वाटर. ऑर्गेनिज्म एक्ट बाय द डिस्टरप्टिंग व्हिच ऑफ द फॉलोइंग? इंटरस्टिशियल एपिथेलियल सेल्स. हाँ जी. फर्स्ट ऑफ ऑल जस्ट इवन आइडेंटिफाई व्हाट इज दिस. दिस इज द कॉलरा. यस नदीम, आंसर बताओ बच्चे. Amruta already gave me the answer. Right, she is absolutely right that the cholera, Vibrio cholerae, we say, they act on the zona occludens. Remember, they're having many toxin, out of which the cholera toxin is one of the toxin, right? Then zona occludens toxin, Zedo toxin is also there. Occludens toxin is also there, right? And this toxin they're asking about, this is going to act on the zona occludens and this is going to occlude that, right? So tight junctions, they are not there. So that's why the the GIT start losing the water. Okay, and that's why we do have rice water stool, right? And the three main toxin, just remember, it also secrete accessory cholera enterotoxin also. So three type of toxin, enterotoxin, it is going to release. Okay, one of the toxin that we talk about, zedotoxin, that is the zona occludens toxin, which will act on the zona occludens. Hanji, beta HCG is structurally similar to what? Beta HCG, not alpha. They are asking. Alpha is similar to LH also, FSH also, and TSH also. Alpha part of the HCG, alpha subunit of the HCG is similar to that of the LH, FSH and TSH, but only one. Yes, LMCH. Okay, Sania, you are right. Doc also right. Nasira, Kartikeyan, David. David bache, think again. Ajit Kumar, think again. Paresh, think again. Nasira, no bache. What they ask? Beta HCG, darling. So remember, alpha is similar to all of them, but the beta they ask, beta is only and only the some part, not all of it, some part, some protein molecules, they are similar to LH, only LH. FSH, TSH will not come. Okay, the alpha unit, if they would have asked, then these three are similar to the alpha subunit of the HCG, but beta subunit only one, that is LH. Okay, let's move on. Which of the following best describe the relationship of the end-diastolic volume to the force of contraction of the heart? Only one relationship we study. You know that, right? Hanji, chalo, answer batao bacho. Ajit Kumar was right at the end. Yes, Nasira, but now you know, right? So be happy for that. No sad face at all. Okay? You're not going to get mistaken again. Hanji, Amruta, are you giving the answer for this, bache? Vijay Kumar, think again. Yes, only one thing that we study, that is length tension relationship, nothing else. Okay, length tension relationship, not the length force. Force is the load that we are giving. We do not count the load over there. We count the tension that is generated in the muscle. Okay, which of the following substance follows given transport graph? Okay, chalo batao. First of all, the transport that they are asking, let's say GIT. Okay, now this, after some time it is getting saturated, right? So let's say the something is getting absorbed, and after some time this is showing the plateau curve, which is telling us the property of saturation, and we call it as saturational kinetics. In the physiology we call it as the substance is following saturational kinetics. If this graph would have been straightforward, that means it is not saturating at all, and the saturation comes whenever, oh, Sneha, think again, bache. Paresh, think again. Hanji. Ashish, think again. I got some right answer from Nasira. I'm happy for you. Chalo. So this is nothing but the glucose. All of other things, they follow simple diffusion. But the saturational kinetics as well as specificity will come with the carrier protein, and the carrier protein the glucose uses is glucose transporter, that is GLUT, right? That is GLUT or GLUT, whatever you call it as. So over here, the diagram they have shown, that is following the saturational kinetics. It is not the simple diffusion, it is carrier mediated transport, and that is nothing but of the glucose. Okay, chalo aage badhte hain. Decrease in the central venous pressure will not cause which of the following? Which of the following they are asking. The central venous pressure is decreased, or you can say if it is increased, what is going to happen? Okay, chalo, question number 8, answer please. If the central venous pressure decreases, what will not happen? Will not cause which of the following? Yes, I got the right answer. That means if the central venous pressure is decreased, the angiotensin 2 will not increase. Angiotensin 2 will not increase. Increase in the ADH. ADH, we want more water reabsorption since the central venous pressure is decreasing. So it needs to increase, right? Actually, the ANP should be increasing over here. So both the answers are correct per se. If it is INI-CET and multiple choice questions are there, then B is also right. Sorry, central venous pressure, no. Central venous pressure is decreasing. So we do not want to lose the natriuresis. We do not want natriuresis. I'm extremely sorry. We do not want natriuresis, right? So, sorry, my mom is calling. Okay. So yes, we do not want natriuresis. So this cannot be the answer. And increase in thirst. Yes, this can happen, right? Increase in thirst. But yes, these two can be the answers. These two can be the answers, right? But again, they said what will not happen. I'm so sorry. So yes, only C will be your answer, which will not happen. Yes, Chintan Parmar. I agree, and we are having a very little time, right? On my channel, I'll try to, take these questions a bit slowly and go with the peace and calmness, right? Discussing a lot more things, okay? I'll try to do that. चलो आगे बढ़ते हैं. आगे बढ़ते हैं. नेक्स्ट क्वेश्चन बच्चों, आंसर बताओ. Answer. Which of the following ions in the thick ascending limb of loop of Henle is responsible for reabsorption? It should be reabsorption of divalent. Now, what they are saying is, see, I got this questions just yesterday. So, divalent ions. Now, they are not asking about divalent ion getting absorbed. They are asking which of the following ion is responsible for divalent absorption. Hanji, responsible for divalent ion. They ask which will not happen, bache. Aditya, they ask which will not happen if the decrease in the this thing CVP will happen. Definitely the angiotensin is not going to increase. Okay, because see, again, tubular glomerular feedback is not there, right? Because the GFR will also decrease. The NaCl, which is going towards the macular densa, will also be less. So renin will not get secreted, right? So angiotensin 2 will not increase. Okay, not increase, they asked. Chalo, aage badhte hain. Now, which ion is responsible? Calcium. They did not ask divalent ion getting reabsorbed. They are asking which is responsible for absorption of this. Yes, please. The answer over here is potassium. Potassium. When we secrete more potassium in the tubule, right, and then we can absorb more calcium over here. We can absorb more calcium over here. So calcium, the potassium is responsible for the absorption of not only calcium but also magnesium. So they ask which ion is responsible, which ion is divalent. That is not the question over here. Okay, बच्चों, चलो आगे बढ़ते हैं. Which of the following is involved in the discriminative touch? That means what they are asking is 2-point discrimination. If multiple choice, then 2 answers will be there, but best answer is always 1. What is the best answer? Hanji, 2-point discrimination or discriminative touch. Batao bachcho. Okay. You guys are going with A. RP bache will discuss that later on. Okay. Insulin causes potassium to go inside the cell, and that's why we give calcium gluconate. Okay, we discuss that your question queries later on, right? Now I already having less time. We are already crossed the time. So remember, the best answer is Merkel's disc. 2-point discrimination best is done by Merkel's disc. First will be the Merkel's, right? Followed by the Meissner's. Always remember that. Okay, both are important for this discriminative touch, but Merkel's will be the best answer. Merkel's will be the best answer. Why and all, it is given in the lectures. Let's move on. Relaxation of intestinal segment distal to the segment with the bolus of food during peristalsis. Now, relaxation. Again, relaxation, we know only one thing over here also will cause the relaxation. That is nothing but VIP. We already discussed that food bolus wala structure, right? So don't forget that diagram. Serotonin will be released on the both of the things, right? That will causes relaxation. That is NO. No VIP is allowed in the front. No VIP. Okay. That will cause the relaxation and move the food bolus forward. Which of the following decreases the amplitude and frequency of the contraction? Decreases the amplitude and the frequency of the contraction. Intestine they are asking about. Now, there are 2 things, sympathetic and parasympathetic. Remember, always remember, whenever the GIT is concerned, the motility and the secretion, parasympathetic stimulates the GIT and motility and secretions of the GIT, 2 things are there. They are always inhibited by the sympathetic system. Agree? So they're asking about intestine. So what they're asking? Decrease, decrease, decrease they're asked. So what can be the answer of this? Yes, yes. Superb, guys. Superb. Intestine के बारे में पूछा है, so you have to go with, and they ask decrease. So that's why we are going to go with this. That is sympathetic system, which is inhibiting the motility, right? Adrenaline will be the correct answer. Next, what is the duration of short-term memory? This is the factual question. Just remember that it is between the seconds to minute. Seconds to minute, not the hours. So this cannot be the question, and only seconds cannot be the answer, right? So the correct answer, even if you know this much amount of information exactly, you do not need to know how much seconds, how much minutes, right? You can see over here 300 seconds, we can convert that into the minutes also, right? So seconds to minutes, you do have a short-term memory, right? Hours to days, months to years, that is your long-term memory, right? So seconds to minutes, so that's why the answer is 300. Last question paper that we have to solve for today, that is 2020 November INI-CET. Hanji, ye batao answer. Which of the following statement are correct? Correct. Depolarization is due to sodium voltage gated channel. Okay, chalo. Nerve का बना देते हैं. This is due to sodium influx. Inward means influx, outward means potassium efflux. Right? That is repolarization over here. Right? And this is, suppose this, if this is the resting membrane potential, and this is because the slow closure of potassium. Slow closure of the potassium channel. Right? So depolarization is because of the sodium. Yes, all of them are the voltage gated channels. Voltage gated channels. ये वाले आंसर्स बताने हैं बच्चों, ये वाले आंसर्स, इसमें से आंसर्स बताना है आपको. यस, कार्तिकेयन, आई गॉट योर आंसर करेक्ट. गणेश बच्चे एक ऑप्शन बताओ, इसमें से ऑप्शन बताना है नीचे से. यस, आदित्य राइट, केशंग राइट, सुपर. Yeah, I am also missing him. Chalo. He's also my mentor, so I'm happy that you also like him. Chalo. Next, let's move on. The answer over here is C. Let's see. Depolarization due to influx sodium, correct, right? Depolarization due to influx sodium to the ligand, wrong, right? Then repolarization is due to efflux voltage. Everything is voltage related is correct, right? Ligand, wrong. Hyperpolarization is also because of the efflux of the potassium, because the potassium channels are not able to close on the proper timing. True statement regarding the skeletal muscle contraction are true segment. True statement. Again, you have to tell me the answer from these options A, B, C, D, not from 1, 2, 3, 4. Okay. This type of questions, they are coming in the INI-CET, so be prepared. Hanji, batao answer batao. Extracellular calcium, most important. Definitely we are talking about skeletal muscle, so obviously not. माइटोकॉन्ड्रिया का तो कैल्शियम रिलीज से कोई लेना देना ही नहीं है. There is no relationship whatsoever with the mitochondria and that to calcium, right? So this cannot be the correct. Calcium releases from sarcoplasmic reticulum, correct. Sarcoplasmic. Sarco uses for the muscle, skeletal muscle especially, right? Sarcolemma means membrane of the skeletal muscle. Sarco used for the skeletal muscle specifically. Endoplasmic reticulum of the skeletal muscle known as sarcoplasmic reticulum, correct. Voltage gated calcium channel on the sarcolemma has no role on the coupling. They do have a role, right? They will open up first ryanodine, this DHPR, and then only they will open up the ryanodine receptor. So this no role is wrong. Calcium channel on the sarcoplasmic role, obviously they need to get open up, and then only the calcium will open, right? So the answer is C, as you guys told me correctly. Let's move on next. When a person changes a posture from supine to standing, he was lying down supine first of all, nicely sleeping. As soon as he get to know, yes, the class is there, he woke up with a smiley face. What is going to happen? Chalo batao, what is going to happen? First thing, increase in the firing rate of baroreceptor. B for baroreceptor, B for breaks to the BP. That means if you apply brake to the BP is going to fall. Already the BP is falling. We do not want that. So this is not the correct option. Right? This cannot be the correct option. Decrease the firing of baroreceptor, definitely, because as soon as he will stand up, the gravity will act and pulling off the blood in the leg veins, that is going to happen, and we need to decrease the firing of the baroreceptor. Vagal output to the cardiac fiber increases. No, already the cardiac output is decreasing, right? So definitely we do not want that to again decrease the cardiac output, because see, venous leg veins mein agar blood is going to get pulled up, the venous return is also going to decrease, right? And that's why we do not want the heart. Already because of the Starling law, the less blood is coming in the heart, less contractility already. So we do not want vagus to increase its firing. Mesenteric vasoconstriction per se, suddenly it is not going to happen, right? And decrease cardiac output, that is also correct. So 2 and 5, B is the correct answer. B is the correct answer. Aditya, Ganesh, David, Karthikeyan, Chintan, you guys gave me the correct answer. Okay. Macula densa formed by which part of the nephron? Chalo ji batao. Yahan pe ascending limb of loop of Henle is not in the option, so that's why we are going to go with the DCT. Okay, that's why we are going to go with the DCT. If the ascending loop of Henle, limb of loop of Henle is in the option, then definitely we are going to go with this ascending limb of loop of Henle. Macula densa, tubuloglomerular feedback mein humne padha tha. Right? Now the graph is given, we have to identify A, B and C. A, B and C. Now what we are going to see in this, if I enlarge this effective molecule radius, if you as you increase the radius, the GFR of that filtration is going to decrease. But what you can see, the C molecules are already having less GFR. A molecules are already having more GFR, and the B molecules are having in between. Now the answer is hidden in the this glomerular basement membrane. It is made up of 3 layers. First is the endothelium of the capillary membrane, then the basement membrane of that thing, and then the podocytes. Right? Now the special area, that is the basement membrane, it is having some negatively charged proteins. Now, as we know, a simple physics, negative repels the negative. So whenever the negative things are going to come in the capillaries, what is going to happen? Suppose the negative molecule comes in this glomerular membrane, right? It is going to get repelled. Already the negativity is there. So this is going to repel this negative molecule, which is known as anion, So that's why the anion, the C molecules are nothing but the anions. The A molecules are cations, right guys? Yes, Ganesh, awesome. The concepts are important. You guys already gave me the answer. So A, B, C, A is the cation. So answer over here. Think again, Nasira. Think again, bache. See, A is the cation. So that's why the filtration is higher as compared to the, if you draw a simple line over here, what you can see, the filtration is much more of the A as compared to the C. Filtration is much more of the A as compared to the C. So these must be the cation, because the cations are attracted by the negatively charged ions which are present in the basement membrane, and they repel the negatively charged ion, that is the anion over here. Okay, and these are the neutral ones. So A is the cationic, polycationic, neutral and polyanionic. Important question. First time this question is given, and this diagram is only and only given in the international edition of the Guyton. Not even in the Genong it is present. Genong mein bhi ek diagram is not there. Okay. So INI-CET people also following the graphs of Guyton. That secret we know now. As filtrate follows through the renal tubules, which of the following maximally reabsorbed? Now remember, glucose and amino acid, they're reabsorbed almost 100%, right? Chloride and bicarb and other ions, they are absorbed almost 75 to 80%. 75 to 80%, and bicarbonate is given in the 2 times in the options. Obviously that cannot be the answer, right? It must be something else. The students, I don't know who made this PPT, they gave it 2 times. Okay, so already one thing is out. Chloride is also not the option. Definitely maximally reabsorbed is the glucose, because we need the glucose, and that's why we absorb the glucose 100%. Then the sodium and chloride, sodium comes, that is almost 85 to 85% we are going to absorb the sodium. Okay, चलो जी आगे बढ़ते हैं. This is known as nomogram, acid base nomogram, right? This diagram is given in the genome. Okay, last chapter of the genome, right? Chalo, thank you Nasira for your answers, right? Thank you for your interaction, which is not making me feel that I'm teaching to this camera. Okay, chalo आगे बढ़िए. आंसर बताओ बच्चों. Simple diagram, if I want to show, you can click a picture and get to know this nomogram. ठीक है, this is the clear cut diagram of the nomogram. So look over here. What is given? What is given? At the downside, that is on the x-axis, what we can see? pH, right? If the pH increase, that means alkalosis will be there, right? Alkalosis, whether it is respiratory or metabolic. Now, you have to see this line. Let's change the color. This line is showing what thing? Carbon dioxide. Carbon dioxide. See, there are 60 questions approximately. I cannot cover it in the 1 hour. That is for sure, right? And bicarbonate, that is given over here. As the bicarbonate increases, we know that what will be happening? The alkalosis will take place. The alkalosis will take place, right? But at the same time, over here, the carbon dioxide is also given. So on the right hand side, whenever upward column is given, that is the metabolic alkalosis. Metabolic alkalosis, the CO2 will try to compensate, and that's why the CO2 will increase over here, and it's a alkalosis, metabolic alkalosis, so pH is also higher side, on the higher side. Respiratory acidosis on the upper left quadrant, come over here. Why it is so? The PCO2 is higher, but look at the pH. The pH is low. The low pH, that means it is acidosis for sure, right? And that's how you have to rule out. Same with the metabolic acidosis and alkalosis. Okay, 3 things you have to see. First of all, check out the pH. The only first thing that you have to check is the pH. Okay, if the pH is more, that means it is talking about alkalosis, whether it can be respiratory or metabolic, right? The pH is the first thing that you want to see in the exam of this acid base disorders. Okay, let's discuss that later sometimes, right? We are running out of the time. We actually ran out of the time, but it's okay. Now, can you tell me the answer of A? I already showed you the diagram. Can you tell me the answer of the A option? The pH over here is slightly less. हाँ जी, क्या डिनोट कर रहा है ये? क्या डिनोट कर रहा है ये? बताइए. नीरज बच्चे फिर से सोचो. सी नहीं हो सकता बच्चों. एक्यूट रेस्पिरेटरी एसिडोसिस नहीं हो सकता है. इट इज द क्रोनिक रेस्पिरेटरी एसिडोसिस, बिकॉज सी द pH is kind of 3.5 to 4.5. It is, most of the things are coming towards normal, right? Towards normal. So it is kind of a chronic respiratory acidosis, which is kind of, you know, compensated by the metabolic acidosis also, because this will be reduced later on. The carbon dioxide will take over, right? So answer over here is option A. Metabolic alkalosis should be there. Right. But both cannot be there, na? C cannot be the answers, bacho. C cannot be the answers. C cannot be the answer. And this is not the acute phase. So this is not the acute phase. Okay. So it can be both mixed kind of acidosis. So my perception is the best answer over here is chronic respiratory acidosis with the metabolic acidosis. Okay, with the metabolic acidosis. Acute नहीं है बच्चे, because acute होता ना तो बहुत इधर आ जाता ये. Acute में you don't have time for the compensation, so it would have been shifted a lot more there. Okay, so it cannot be acute, right? Chalo, we'll discuss that in the a bit detail later on. Now let's move on to the next question. Resecker fluid. Okay, we are about to complete. Chalo, energy, dinner भी करना है, सोना भी है. हाँ जी, resecker fluid, diluent. Now resecker fluid is used for the platelet measurement. Platelet measurement, and platelet is measured by the RBC pipette. RBC pipette. RBC pipette से platelet count करते हैं, and then we do the RBC count also. With the WBC, we do 2 counts. WBC pipette से WBC count and the eosinophil count. So that's why over here 101. Remember the RBCs are less in number, right? And that's why we use this wala bead. But the platelets and, as I told you, the RBC, we are going to use this RBC pipette. We are going to use RBC pipette for the platelet. We are going to use RBC pipette for the platelet measurement. Chalo, let's move on. Least frequency BER. Least frequency BER is found in what thing? Okay, I should have that. चलो नहीं दिया है. Least frequency BER. BER is basal electrical rhythm. Basal electrical rhythm. You need not to think about it. Okay, something happened. Thank you, Hardish. Oh, RBC count. Yes, Ganesh. You forgot? Chalo, I made you remember. Stomach. Yes, guys, right. BR, what I told you is proximal stomach and the distal stomach. In the proximal stomach, we do not have the pacemaker cells. BER. There is no BER, right? In the distal stomach, the BER will be present. Some cells will be present of the pacemaker cells, but they sense the chyme. If until and unless the chyme is formed, they're not going to get activated, right? That means semi-solid things that we have to make over here. We have to make a proper mixing with the HCl, and that's why this is going to sense the chyme. Unless and until semi-solid mixture is going to take place, till that point these BER will not be active. Okay, till 4 BERs we are going to have over here. Now remember, this is beneficial for the relaxation. We need a relaxation in the stomach. Why? Because we need to want some time to mix the food properly with the HCl and all the acids or the pepsinogen and everything, which is going to get secreted by the stomach. Okay, chief cells and all, right? So that's why we need that. Maximum BER किसमें होता है बच्चों? Maximum BER, can anybody tell me maximum BER? हाँ जी बताओ, maximum BER किसमें होता है? Chocolate question. Many a times this question also came. Less activities will help storage and mixing also, right Ganesh? Awesome. You do have that much of the patience to write in between. Good, good, good. I like that. Calculate the respiratory quotient. Respiratory quotient, very, very easy. How much oxygen you take and how much carbon dioxide your tissues are going to form via using that particular, what thing? Via using the oxygen. So that is nothing but your respiratory quotient, right? 200 upon 250, easy, very easy. That is nothing but 0.8, right? No need to think, it is normal thing. Right, all of you, I'm happy about that. Amrita, RK, Vivek, Doc, awesome guys. So yes, 0.8. Neeraj Kumar already gave me the answer. Right. Editor, think again. Answer cannot be 1, na? Answer cannot be 1. Yes. Jaya also, Aditya also. Chalo. Next question. We are about to finish now. Now, what they ask about the Minimum titillizing frequency, MTF formula, 1 upon contraction period. 1 upon contraction period. You must have remember the 3 periods that we teach you in the physiology first year. First is the latent period. I'll not take this color. Latent period. This till the maximum peak from the starting point, that is the contraction period, and this is the relaxation period. Now if you use 100 hertz ka tuning fork, that means 100 oscillations will be there, and from one crest to another crest we say it as one wave, right? That is 0.01 second, right? If you are using 100 hertz ka tuning fork, let's count out how many waves are there. How many waves are there? First, second, third, fourth, fifth, and almost 6 waves are there. From one crest to another crest, right? Crest to crest, we measure the waves, right? So there are 6 waves. So what we can write? How much is the time? Contraction period is asked, not the waves. So one wave count out for 0.01 second. So obviously 6 wave will count out for 0.06 seconds. Agree? Now, what will be the answer? Hanji, I already know the answer. Can you guys tell me the answer, please? This will be in the points 1, 6 point something something, right? 16 is not in the answer. So the nearby answer is 17. The nearby answer is 17. Let's check out. It should be more than 5, like something like that. Okay. So 17 is the best answer over here. Okay, 1.06. Understood? They ask about the contraction period. You have to count out the waves. Yes, Dr. NP is right. Shirsha is right. Vivek is also right. Awesome, guys. So thank you all. That's all from my side. Right. I hope you like the session and read a lot. Set yourself free in the ocean of this knowledge, right? And love physiology and love physiological concept. Keep on reading, keep on motivating yourself and the surrounding area. Keep on vibrating a positive energy, right? And all the very best for your exams. And that's all from my side. Thank you. Bye bye and very good night. Love you all. Okay. Bye bye, guys.